Hi, I am Dr. Dhrumin Sangoi, Orthopaedic foot and ankle surgeon practicing at SLRH Hospital, a Fortis associate at Mahim, Mumbai. I'll be talking about Charcot foot. So Charcot foot is a common condition which is seen in diabetic population, and it affects quite a few patients who have diabetes and high sugars in their blood. As we all know that India is a capital of diabetes now, and roughly around 11% of India's population, which comes to over 100 million, is suffering from diabetes. And Charcot foot can happen in these individuals primarily due to diabetic neuropathy, which means that the nerves in the foot, they stop talking to the brain, and hence as a result the bones in the foot, they dissolve and disintegrate. Charcot foot can be seen in individuals of different age groups. We have patients coming who are quite young till the older age group. We see all patients, and once the bones start to dissolve and disintegrate, they become softer, and that can cause pressure deformities in the foot and ulceration. Ulcers, which is a wound in the foot, once it forms, it is very difficult to get it healed in diabetic population. So the most important thing for us all Indians would be to try and prevent development of Charcot foot. So this can be done by a proper care of your diabetes with your diabetologist, where you maintain your blood sugars, and if there are any issues in your foot, it is better to see a foot and ankle specialist earlier rather than later. Things to watch out for are decreased sensation in the legs, any form of wound or ulceration developing in the leg, any form of calluses or corns which is caused by pressure deformities developing in the foot. Once you notice that, it is important that you get it checked by your specialist and take appropriate care and treatment to prevent it from getting worse. So once the Charcot foot happens, we do some X-rays and MRI investigations to study about it in detail, and then there are various treatment options available to control it. The main form of treatment which we provide are something called as plasters, which we call as total contact cast, that will conform to your whole leg, and you have to avoid weight bearing on it so that the bones which have become soft, they try and gel and unite and become a solid mass. Once that forms, your Charcot foot can be taken into control. However, if that is not taken into account in the beginning, then we often get patients who come at late stages with chronic deformities in the foot. So once the Charcot foot develops into a later stage of deformity and ulceration, then we have to manage it aggressively, which includes a surgical reconstruction of Charcot foot. This is done here at Raheja, where we have a team of orthopedic surgeons who manage this and take care into this, so that we can provide you with a stable, rigid foot. So once everything heals up, you are able to manage and walk without any problems. Our aim is to prevent amputation and save the limb. So that's our motto, and that's how we work at SL Raheja Hospital. Thank you.